Welcome to part two. The second most common question we get about the Gottman Method is the assessment process. So, this is how we do it. Other Gottman therapists might do it a little bit differently, but this works for our therapy practice. So, we do a 4-session assessment process. The first session is what is called the oral history interview. So, you and your partner come together and we ask you questions from the beginning of how you met all the way up until today. We're looking at your definition of a good and bad relationship, what was modeled in your family background growing up. We ask you about how you met, what dating was like, what the engagement process was looked like, the wedding process, honeymoon, adjustments to parenting, big life transitions, the good, the hard. It's a pretty thorough questionnaire. And after that first session, what we call that intake or oral history session, we will send you the Gottman relationship questionnaire for each of you to complete. And then we schedule an individual session with each of you. The intention of that individual session is to hear each of your perspectives, your experience of the relationship, what your hopes and goals are, what your concerns and challenges are. We do a deeper dive into the family history that you come from, mental health history. We do assess for any abuse history that you might have, whether that's substances, sexual abuse, drug abuse, emotional, physical abuse. We are trying to understand each partner's perspective, and we're gathering all this data so that in our 4th session together, it's what we call treatment planning. We take all of the individual and the joint sessions together, the relationship questionnaire, and we help you see where your strengths are in your relationship, where your challenges are, and we formulate a plan of the work we're going to do together in couples counseling. It's meant to be collaborative. The therapist, myself, I come prepared to talk about where I'm envisioning the work, but I'm also checking in with the couple to see where their thoughts and feelings are. Is it in alignment with the hopes and goals they have? Are there things that I'm missing or things that they're surprised that I'm not bringing into that treatment plan so that we have a firm process moving forward that's not just my perspective as the therapist, but your perspective as a couple. I see things that maybe you don't see, and you see things that maybe I don't see, and so it is meant to be collaborative. I'm not here to be the expert of your relationship. I'm here to help you become a better expert in your relationship and to have better tools and skills to implement and to provide that psychoeducation, that research, and be the third party out of the relationship that can be more objective because I'm not in it. Oftentimes, the couples we work with will be like, man, you said that a whole lot better than I did, or what Rachel said, or what Dion said, or whoever the therapist is. And the reason we can do that is because it's not our relationship. We can empathize, we can validate, we can say we've walked in your shoes before with what you're going through. But because we're not in the emotional state, sometimes the way we go about it or we engage in it and understand it is a little bit smoother or it comes out better than what you intended. So that's the assessment process. We do it in 4 sessions. I know there are therapists who do that oral history and individual interviews all in one session, which is usually a little bit longer. This works for our practice. This is how we conduct that assessment process with the Gottman Method, and we find it really useful. I know for myself, when I first started doing couples work, I wasn't doing the Gottman assessment process to a T. I was using the oral history interview and totally skipping over the individual interview process, which is not the way it's meant to be done. And once I fully understood the intentionality of the assessment process, I haven't done it in a different way since, because it's so important. There's so much data we gather. There was so much I was missing in my previous couples therapy work, and I'm so sorry to those clients that I was missing gathering that data, though we probably did good work if you're watching this, that I ensure that it happens with all of my couples. Even if we're not doing strict Gottman method, I slow down my assessment process because it takes time to build trust with the therapist. It takes time to build trust with the client, and and learn about them, what they're needing, what they're looking for. And I truly believe assessment shouldn't be rushed. And I kind of started in the field thinking it needed to be rushed. And now I'm on the other spectrum of slowing it down to make sure we've got the data that we need. So, questions about this assessment process of the Gottman Method. I'm level 3 trained in Gottman. I'm not certified in Gottman. I'm not John and Julie Gottman, but this is just kind of that behind the scenes of a couples therapist and how I utilize this and how we utilize it in our practice and answering a common question we get in our consultation experience.